Everybody. I am so excited to be being recorded. We got it. Okay. I am so excited to be here again. I love kind of sharing with you guys. This is one of my favorite topics, animal assisted therapy. I want to start off by saying all of these pictures, this is like my favorite presentation that I've ever made because it's just like all of my pictures of therapy animals that I have worked with, some failed ones, some successful ones. So all of these are like real live. I didn't pick any of these off the internet. They're all mine. So this is my puppy Nutmeg. She is not a therapy dog yet. Maybe she will be, maybe she won't. We're not sure yet. We'll see how it goes. But we'll run through some animal-assisted therapy information. So I'm Dr. Teresa Rogers. I own the Relationship Center. We have it's a mental health private practice. We have 2 locations, one in North Canton and then one in Mayfield Village. I am certified in animal-assisted psychotherapy. There's not an official certification program through like any counseling worlds, but there are a bunch of kind of like certifications you can pick up. So I did one in Colorado, I've done one in Arizona, a couple in Ohio, so kind of picking up certifications as I go along. I wrote my dissertation on animal-assisted therapy, so that's a published piece you can Google it, it's out there. And I actively right now have a collaboration with a barn farm called In Step with Horses. So we do equine assisted therapy. So my private practice kind of collaborates with the horses and the equine specialists at In Step. And so I schedule about 5-6 clients a month, and I meet my clients there, and we work with the equine specialist and the horses at the barn. And so that's been a really great way to like integrate animals into private practice land without having to own your own barn and farm and horses because they are very expensive. So that's been a really cool thing we've been doing for about like a year and a half now. So this is Violet. Little story about Violet. Violet, him. He was found in my friend's backyard, and we kind of co-parented him when he was a tiny little baby. Here's a picture. That's Violet when we found him. A little tiny thing. He needed to be fed kind of with a syringe every 4 hours. Couldn't pee and poop on his own. So like he came to the office with us, all 4 of the clinicians we had there. We kind of like pass him from room to room each hour, and our clients would help with him and he would be there. And so like we raised him as this tiny little kitten all the way through as the therapy cat, which was an amazing experience for everybody. He turned into an adolescent cat and then no longer wanted to go to work anymore. And so he no longer comes, but he was there for probably like 2 years. And that was a pretty fun experience. So that's little baby Violet. So cute. So our goals for today, we're going to go over the difference between animal-assisted interventions, animal-assisted activities, and animal-assisted therapy. 3 different things. We will talk about applications and intervention, how to use animals, whether you have them or whether you don't actually have like a physical live animal, what you can do with that. And then this is a big topic. It's not a 20-minute topic. Seems to be like all the topics I choose. So there's a lot of further consideration. So I just kind of made a whole list. We'll kind of bounce through them real quick. Just if it's something that you're interested in, there's a lot to consider from a lot of different angles. All right, so starting off with differentiating between the different kind of animal-assisted stuff that we can do. The first one is animal-assisted interventions, which is a very broad overview of kind of any integration of an animal into something, some activity that helps humans. So there's a partner, there's a handler that's partnered with a therapy animal. They're working as a team to assist others. The goal is to benefit humans but also to provide a positive experience for the animals. We are not forcing them. We are not coercing them. We're not exploiting animals. Like, animal welfare is more important, in my opinion, in animal-assisted interventions than the human component of it, where I'm more concerned about making sure the animal is good and they are consenting and happy to be here versus the human, because I can work with the human and have an interaction with the human without the animal. So we could keep them separate if the animal is not a fan. So kind of really keeping that in mind, that animal welfare is paramount here. So the animal-assisted interventions might actually have a live animal, or it may not have a live animal, and we'll talk about that in a little bit, but it doesn't have to have an animal. So if you don't have an animal handy that is like, yes, I want to be here and I'm great at this, then there's other options that you can still integrate animals into your work. These little friends. So the bunny is my bunny Coconut, and those two guinea pigs are Max and Rocky. They were actually my son's preschool's guinea pigs that, of course, I took for the summer and then became overly attached and got them a whole new cage and a setup and a whole thing. And then I was like delivering lettuce to the teacher. So like I get connected to these things and they're just so wonderful. So Coconut and the Max and Rocky were hanging out. So Max and Rocky never actually came to my office with me, but looking at animal assisted interventions, them being as a part of the classroom, that is an animal assisted intervention. I would maybe think about whether they're being forced, coerced, or exploited in the classroom. I don't know how much they consent to be there, but like classrooms do this, and so like that's a whole other thing. So, but that is providing the students some learning environment, some connection with animals, and so that does fit under this kind of category of animal-assisted interventions. Keeping in mind that service animals are a completely separate thing. Service animals are not a part of animal-assisted interventions. They are trained to do work to help people with disability. So they're a completely different entity. We are not talking about service animals in any way when we're kind of talking about animal-assisted therapy. So the next is animal-assisted activities. So animal-assisted activities are with a trained professional or a volunteer that is associated with that animal. So the volunteer or the professional is connected with that animal. It's their animal. They take them home. And they're short sessions, they're informal sessions. So like visiting a hospital or long-term care or reading at the library with kids, or I know a bunch of colleges have therapy animals come out like in finals week. So there's no treatment goals connected to this. The animal and the handler are there, and it can be with a bunch of different people. There's not a treatment plan, there's no documentation, there's no notes. We are enhancing the lives of humans and we are enhancing the life of the animal, but it's not in a direct therapeutic documented type of way. So that top picture up there, at a school we went and we made feral cat boxes with the students. And so that was an animal assisted activity. We didn't even have any animals with us, but we were doing this activity. We were talking about cats and there's a lesson connected to all of that. And then we were kind of giving back to our community by creating these feral cat boxes. So that kind of would also fall under that animal assisted activity without an actual animal present. And that bottom picture, that's at In Step with Horses. We were doing a training for my staff. So for the people that work at TRC, we were there a couple weeks ago. It was hot. It was like when all the allergies were really bad, we were there, and like half my people were having a rough time. So that's also something to keep in mind. We'll talk about later, like allergies. That's a big thing to be considerate of. And then the last is animal-assisted therapy. So this is the last, or animal-assisted psychotherapy. There's a little fight in the community about those two things, but we're going to lump it all together in that animal-assisted therapy is structured and it's goal-directed. It's a part of the treatment. The animal is your co-therapist. They have an important part of the system and they have an important part of the treatment. It's not just recreational, like we're taking the dog for a walk because it's fun and it's making you feel better. Like there's a reason and there's a treatment goal related to that. Animal assisted therapy, there is a professional, there is a licensed person with expertise regarding clinical application. We're promoting physical, social, emotional, cognitive functioning. So we have a goal that is related to the mental health, related to the client needs, and it's documented and it's evaluated. We're looking at the outcomes. We're making sure that that the client is improving, that the animal is okay, that utilizing the animal and integrating that animal into session is having a positive outcome. So we are really documenting with that treatment plan. Sessions are like a normal session. They have a fixed amount of time. So that's Violet there. That's when he got a little bigger. He just laid in my window and he was the attack cat. So you had to look out because sometimes Violet would consent to interaction with you and sometimes Violet would not consent to interaction with you. And that was also a very important lesson for a lot of people. So this we're just talking about the difference between service dogs, therapy dogs, and emotional support animals. And so really what I wanted to touch on with this just so briefly is the emotional support animal world. It's really blown up. People are trying to get it back under control. So it was like, didn't really exist all that much. And then there was like no regulation to it and the pendulum swung all the way. And now we're coming back into this middle land here where there is some regulation on what is an emotional support animal, who is evaluating emotional support animals. Should you as a clinician be evaluating emotional support animals and writing letters? The Ohio board put out a statement that's very clear that gets you off the hook for having to write ESA letters for anybody if you do not want to write them, saying that it's not within your scope of practice because something that you're doing within writing that ESA letter is saying that this animal is okay for plane travel or housing. And most of us are not trained to be doing those animal assessments. So that is important to be able to differentiate and be aware of. And you can always say, if someone's asking you for an ESA letter, you can always say, like, I'm sorry, my board doesn't support that. You can send them this snippet quote from the board stating that. Now, if you are good to assess the animal or you have a relationship with a trainer, so like a dog trainer or something, so I will send people to, I have like 2 trainers that I trust and have a working relationship with and say, hey, go to them, work with them, because again, the animal welfare is what I'm most concerned about. Putting a dog on a plane and walking him through an airport that's going to cause a ton of stress for that animal has long-term physical implications for that animal. And I want to make sure that that animal is safe and is healthy and is okay. And no harm's going to come to that animal because it's human wants to take it on a plane with them. So I will refer to a trainer. And then if I am okay writing that letter, then I'm getting that trainer's word as well. So again, I think it's always important to err on the side of go with what the board says of like, nope, we're not writing ESA letters unless you really are very competent with animals, you're assessing the animal, or you have a relationship with somebody who will assess that animal and kind of take that side. All right, next we're moving into what the research indicates. So this is Doc. He is probably my favorite horse in Step with Horses. He is so I work with an equine specialist there and her name's Emily. And so that's her horse from like childhood. So her and Doc have this amazing relationship. They do like tricks together. And so Doc's amazing, love Doc. So for animal assisted therapy, there is research out there. Like we are turning this into there's some evidence out there. It was when I wrote my dissertation 15 years ago, there was only like some anecdotal stuff out there. It wasn't built up, especially related to mental health. But everybody has been working very diligently in building these outcomes. So you're going to see increased self-efficacy, increase in self-esteem. You'll see lower levels of anxiety and depression. Social skills are impacted positively, quality of life. People are so excited to work with animals, they just come for that. And just to see how that impacts them in that moment is so amazing. Reduce distress while processing traumatic and emotions, that's very true. I have people that will come and talk and they're just stroking the horse and telling me all kinds of stuff. And you can tell when it gets to be a lot, like the horse responds, they kind of respond to the horse. And you see this really like nice symbiotic relationship playing out. You'll see improvement in empathy and communication and socialization. And also there's a big chemical component that happens. You're gonna like, your mood improves because there's more dopamine being released, there's more oxytocin because you're having this positive connection, your cortisol levels go down. And so just the chemical, biological side of what interacting with an animal does, even like cats purring, there's a ton of research supporting that. Just like having a cat purr on or near you will reduce your heart rate, will release oxytocin, will release more serotonin to kind of help re-regulate you down. There's also physical outcomes about like heart research as well, related to heart functioning and cats purring. So lots of good stuff out there about research. Remembering that this is a partnership. This is really important. The animal has to consent. The animal has to be okay with like fitting into the service and wanting to serve. And you'll know when your animal isn't. That's Sunny. She was going to be my therapy dog until one day I brought her to session with a couple. And the guy came in and he had this like black hat on and he was in a mood. And like, I knew these people for a very long time. They're amazing humans, but he came in pissed. And Sunny sat next to me in my chair and like low growled at him the entire session. And it was like, okay, this is not great because Sunny is like protecting me. And then the wife was like a little dissociated while he was like all like grumbling over here. And so like Sunny snuck out behind my chair and like tapped the wife on her toe, which was fascinating to watch because it like brought her back into her body. And I saw that, but then like Sunny, which was positive for the humans, right? But then Sunny came back, went behind my chair, kept like at the guy. And so like right there, I know like this isn't okay for Sunny. It was good for the humans, but the animal welfare is my priority here because she's my partner. I'm not hanging her out to dry and putting her into uncomfortable situations. So always making sure you know your animal and you know whether they're consenting or not. We also had foster puppies at the office for a little while of time. We had like 5 little foster puppies running around. So this was one of the foster puppies that was a failed foster because my coworker adopted her. So she still exists in her life. If you're interested in your dog becoming a therapy dog, these are the steps. Start with AKC Good Citizen program. Then Google Pet Partners and dive into the Pet Partners world. They will tell you what has to happen next. They will give you kind of all the steps. So you want to follow that and making sure you're meeting standards of care. Okay, application. There's Violet being a great therapy cat, just passed out on my couch, which again is great. So Animal is your co-therapist. It's helping your clients feel safer. It's offering them a connection, a non-judgmental connection that you might not be able to offer them. It also offers them physical touch that like we can't do for clients. So to have like a big pit bull sitting on your lap is really the best hug and connection and grounding experience that you could ever have. But like, I can't go sit on my client's lap and give them a hug because that's not appropriate and kind of weird. So animals can really meet that physical touch need that really goes a very long way with clients. It really helps improve communication because they're having to read the animal, they're communicating to the animal, we're teaching the animal things, we're working with the animal in that way, and the animal doesn't always respond well, which teaches us, again, a lot of great information. If you don't have a live animal, you don't need a live animal. So this is behind my office in North Canton. We've got 2 baby deers and a mama deer. They come usually once a day and eat the birdseed and kind of hang out and play a little bit. And so like my clients, we sit there and we can talk about the deer. We can watch the deer. We can regulate our nervous system. There's always squirrels out there. There's always chipmunks out there. So like we're watching them play and it's like, all right, sometimes that's just a nice pause from what's going on in their session. Or if they're activated, it's like, huh, wait. And then the groundhog like comes and waddles out. It's this big groundhog, right? And so then we're talking about the groundhog. And like sometimes it's just this nice balance that also makes you as a therapist kind of like a person too. Cause like I love these animals as well. So if you don't have a live animal, you can use stuffed animals, you can use pictures of animals, you can YouTube videos of animals, you can go outside and stare at the clouds and imagine what that rhinoceros is thinking right now. So many options. That doesn't have to be like, oh, I have this dog in session with me. So also at the office, we have foxes. So this mama fox has been running through for like 2 years and she never really stopped, but we'd see her run through. And then this year she had 3 little baby foxes, and these little baby foxes come and they play. And oh my God, it's the most amazing thing. Like, it might not even be therapeutic. Like, I will literally stop session in the middle of session when these foxes come. I'm like, we're done talking. We're going to sit here and watch these foxes because it's amazing. And so clients love it. But again, that's our outside. And then these little friends are from our Mayfield office. So like in our parking lot, right there in the rocks is a mama killdeer. She's sitting on her eggs, and that's the dad killdeer that like is hanging out in the parking lot. And so I spent the better part of 2 days watching them, and they're just like right outside your window. So like we don't need to have like fully trained animals. Like, animals are around, we can use what is just going on outside of us. So if we have a bird feeder, bird feeders are great. So I love these killdeer. And then I think the garbage truck went by and scared her, and I was all mad at the garbage truck. So being able to apply this, it's applicable in so many places. Like if we're working with attachment, right here, we're bonding with this animal and it's offered a secure attachment that has no judgment connected to it. If we're looking at nervous system activation, watching a horse graze and just chew and walk slowly, watching fish swim, that's at the Georgia Aquarium, that fish there, is very calming to the nervous system. You will see that it's going to slow the breathing down. It's going to slow the heart rate down. When you're petting a cat or a dog or hugging an animal, your blood pressure is going down. Social skills will improve if you just have a client, a child, like read to the animal or talk to the animal. It increases cooperation and engagement. Like, hey, I wonder what this little puppy's thinking right now. Like, how could we get him to do something? Because yelling at him is probably not going to work. So like, how else could we? We're doing behavior modification stuff with the animal, which is also teaching like the kiddos what that means and what that looks like. Body language is so important in interpersonal dynamics. Like, these animals aren't talking to us, so we are reading body language, and we have to be keyed in on that nuance. So if like I'm sitting there and the horse's ears are like this, like, okay, we're cool. But if the horse's ears like go back and flat, like that means to me the horse is scared or the horse is upset. And so I need to be able to read that and understand like, okay, how am I going to adjust myself in relationship to that? And so we're teaching our clients those keys that also help in interpersonal relationships. Already kind of talked about the neurotransmitters. Responsibility and routine. We have to care for these animals just like we have to care for ourselves. We have to care for our people in our lives. And so having these animals really will help teach that. Same thing if your clients, if you're in home and they have pets. All right, tell me about your routine with like Sunny over here. What do you do for her? How do you work with her? How do you know when she's hungry? Do you feed her? Do you give her water? Like, what about yourself? How do you know when you're hungry? Like, are you drinking water like Sunny's drinking water? And so we're working in that routine and responsibility piece as we're working with clients. And then you don't even need to have your own, you can use their pet. We can talk about their pets as a part of that system. And then also the physical activity piece of we're moving our bodies. So that's another picture of Doc. See, his hair's all braided there. My client right there, she braided his hair one session, and that was super calming for her. And then here's our interventions. Again, the projection in the storytelling is really key. You learn a lot. And so making sure that you're not putting words in the mouth of the client. So you're asking them, like, what do you think Doc's thinking about right there? Like, I wonder what's going on in Doc's mind. What do you think? You're going to get a whole story about this person, and it's all a projection of what's going on internally. Really helps setting boundaries. Like, if you need to move this giant 1,000-pound horse, I'm going to need to set a boundary, and I'm going to need to do it pretty assertively. How am I going to communicate that to this horse without it doing whatever it wants? Because it's way heavier than me. I can't use my body to manipulate that. I need to use my energy, my words. Mindfulness and breathing is so important. We can just breathe with the animal. We can hug the animal. We can give the horse a hug. There's biofeedback stuff that goes on that, like, especially around a horse, their heart rate's slower than humans. And so up to 6 feet, if you're within 6 feet of a horse, your heart rate's going to match their heart rate because it's bigger and slower, and it's going to slow you down, which is really freaking cool. I know I'm way over time. I apologize. I'll skip distress tolerance. I like this one because it's a DBT thing. So that improve mechanism in DBT. So imagery, meaning, prayer, relaxation, one thing in the moment, vacation, encouragement. Spells improve. So it's a DBT skill for distress tolerance. All of that can be compacted into sitting with a dog or watching a fish or standing next to a horse. Like, we have the imagery, we make meaning, there's this higher power piece to it. It's providing relaxation. All we're thinking about, one thing in the moment, is this dog that I'm touching right now, kind of in a mental vacation because I'm petting a horse. It's pretty cool. And the encouragement. So like, you can get some good DBT skills like while you're working with these animals, or even like watching one like on a YouTube video. In home, so again, like this little otter scale, we don't need to have an otter. Here's a great thing to use. We can talk about each one of these. How otter are you feeling today? We can use imagery. If you are going to be in home and there's a pet handy, make sure that like you're getting consent from the owner of the pet, that you do have a relationship with the pet in some way, shape, or form, so that you have an idea if the pet doesn't really want to do this. And if the pet wants to walk away, great, the pet can walk away. We can always have a plan B and do something else without Hazel hanging out next to us. Like, Hazel can go and take care of herself. And so just making sure that you're seeking consent on that with the animal and with the adult connected to the animal. And then here's final considerations. We don't have time to go through any of them. The only thing I would add, this is Lily. She was a therapy dog at our practice, and she passed away, and that was awful for everybody, clients, her therapist, us who worked with her and walked her every day. So grief is really something to keep in mind, and like how you're going to honor her. So we had her little bowl and we put her collar around it, and then all of her clients like made little rocks and colored them and filled the bowl with the rocks. So like trying to make sure that like you are accounting and managing for grief and what happens if the dog gets sick or the dog's not doing well. Or if worst case the pup dies, like the animal dies, that you have that considered already of how you're going to handle that. So these are the other things like allergies, fear of animals, susceptible immune systems. You want consents put out there and written and agreed upon by your clients before you ever dive into this. So those are some things to consider. And that's all I got. I went over. I so much apologize. I just get excited about this topic. So if you have any questions, please email me. I'm happy to talk about it all day long.